Ulnar nerve is also called as musician's nerve because it controls fine movements of the fingers. Before we discuss the ulnar nerve, let us see this question, which was asked in AIMS 2002. A boy presents with injury to medial condyle of the humerus. Which of the following would not be seen? A. Weakness of the ulnar deviation and flexion, complete paralysis of the third and fourth digits, atrophy of hypothenar eminence, decreased sensation of the hypothenar eminence, paralysis of all lumbricals, and paralysis of all interossei. Now see, the original question was that only these A, B, C and D options were asked, but I added these two options E and F to completely cover the ulnar nerve. Now to understand this question or to answer this question, let us first discuss the muscular and cutaneous supply of nerve. In thorax, ulnar nerve start. Okay, so ulnar nerve starts as a continuation of medial cord of brachial plexus. Now medial cord of brachial plexus also gives other four branches which I have discussed, but also here you can see that ulnar nerve is starting as a continuation of medial cord of brachial plexus. Okay, now just to see a brief course of ulnar nerve, whatsoever ulnar nerve does not give any branch in the arm, because anterior muscles of arm are supplied by musculocutaneous nerve and the posterior muscles of arm are supplied by superiorly by axillary nerve and inferiorly other all muscles are by radial nerve. In forearm, ulnar nerve supply only two muscles, that are flexor carpi ulnaris and medial two digits of or medial half of flexor digitorum profundus. Now remember this because this causes ulnar kilo hand. This fact causes ulnar kilo hand, or I can say this fact causes ulnar. As ulnar nerve go down, as ulnar nerve go down in the hand, it divides superiorly or superficially to the flexor retinaculum in two parts, the superficial part and a deep part. The superficial part I will be discussing. Now see, ulnar nerve passes behind the medial epicondyle of humerus, and this passage is called as cubital tunnel. This passage is called as cubital tunnel. Okay. Now this is a diagram of elbow AP view showing three major nerves of the upper limb. Now if there is a fracture of supracondyle humerus, if there is a fracture, then if the distal fragment, this fragment is shifted anterolaterally, then there are chances of radial nerve injury. And if the fragment is shifted anteromedially, distal fragment is shifted anteromedially, then there are chances of median nerve injury. And if there is a fracture or injury to the medial epicondyle or medial condyle of humerus, then there are chances of ulnar nerve injury. So in the question, if they are asking if it is mentioned that there is a anterolateral dislocation of the distal fragment, then you have to think about radial nerve. And there is if there is anteromedial dislocation of the distal fragment, then you have to think of median nerve. But if there is if medial condyle injury of medial or medial epicondyle injury is given, then you have to think of ulnar nerve, because ulnar nerve passes behind the medial epicondyle. Now after passing behind, this is an X-ray radiograph of elbow joint. See, this is of adult. Okay, so you can't tell that this it is right side or left side until and unless it is written on the radiograph. But here you can see that it is medial epicondyle, because medial epicondyle is more prominent than the lateral epicondyle. It is lateral epicondyle, and it is olecranon process of ulna. This is ulna going down, and this is radial head, and this one is radial neck. This is radial tubercle, and this is radius going down, and this one is olecranon fossa. On the lateral view of on the lateral X-ray of elbow joint, you can now see radius is more visible, or you can see the fracture of radial head or neck of radius more prominent or more visible on a lateral X-ray. Okay, here it is all the radius, and this is ulna, this is ulna, and this is this is humerus. Sorry, this is humerus. See, this white line is supracondylar ridge. Okay, and this one is coronoid process. Okay, now in the forearm, ulnar nerve passes between the two heads of flexor carpi ulnaris muscle, and it descends down under the flap of same muscles. Now all the three nerves, median nerve, radial nerve, and ulnar nerve, passes between two heads of some muscle. See, flexor carpi ulnaris gives passage to ulnar nerve, and pronator teres give passage to median nerve, and supinator, two heads of supinator gives passage to deep branch of radial nerve. Now remember this point. Coming down to wrist joint, at wrist joint, ulnar nerve divides in two parts, a superficial part and a deep part. Now see, superficial branch gives rise to muscular branches and a cutaneous branches. Now muscular branch give supply to palmaris brevis muscle. There is a palmaris longus muscle. Here you can see tendon of palmaris longus, and this one is tendon of flexor carpi radialis muscle, and this is which is most medial is tendon of flexor carpi ulnaris muscle. Okay, so ulnar nerve, now here you can see ulnar nerve is divided into two parts, superficial part and a deep part. Superficial part and a deep part. Now see, superficial part gives two branches, as I told, muscular branch and cutaneous branch. The cutaneous branches are to medial 1.5 digit. The little finger has cutaneous supply only by ulnar nerve, and the medial side of ring finger is supplied by ulnar nerve, but the lateral side of ring finger is supplied by median nerve. Okay, the deep branch passes between two heads of. Now see, deep branch passes between two heads of between abductor digiti minimi and flexor digiti minimi. Then it crosses the ulnar aspect. Then of hook of Hammett. Here you can see ulnar aspect of hook of Hammett, and then it runs laterally under opponent's digiti minimi and long flexors tendons over the base of middle three metacarpals in the concavity of deep palmar arch. Okay, so here somewhere here will be a deep palmar arch, and in the concavity of deep palmar arch, ulnar nerve, deep branch of ulnar nerve goes laterally, and it supplies medial all the introitiae. It supplies all the introitiae, and it also supply medial to lumbricals and adductor pollicis. Now see, adductor pollicis is supplied by ulnar nerve, and all the hypothenar muscles are supplied by ulnar nerve. All the thenar muscles are supplied by median nerve. Lateral two lumbricals are supplied by median nerve. The lateral two or lateral half of flexor digitorum profundus is supplied by median nerve, but the medial half of flexor digitorum profundus is supplied by median nerve. So this is all about the. Also, hypothenar muscles are flexor digiti minimi, abductor digiti minimi, and opponent's digiti minimi. Also, palmaris brevis is already in hypothenar muscles. So hypothenar muscles are, you can remember hypothenar or thenar muscles both by the mnemonic AFO. Okay, so A is for abductor digiti minimi, F for flexor digiti minimi, and O for opponent's digiti minimi. Similarly is the mnemonic for thenar muscles, where you will use in place of digiti minimi, use pollicis. Okay, Now, before discussing ulnar kilo hand, it is important to know why ulnar kilo hand happens. Because the simultaneous flexion and extension action of lumbricals and the interossei. Now, see here. You can see first of all you can see extensor digitorum. Okay, so extensor digitorum is inserted on the dorsal aspect of hand by extensor expansion. Okay, extensor expansion. The lumbrical muscles are also inserted on laterally by extensor on the extensor expansion. Okay, also the interossei are also inserted on extensor expansion. Now this is the tendon of flexor digitorum superficialis, and this is the tendon of flexor digitorum profundus. Okay, now see extensor expansion. Extensor expansion is the base is here from on the metacarpophalangeal joint, and the apex is at the base of terminal phalanx. Okay, it is triangular in shape. Now see here, you can see that extensor expansion is divided into 3 slips. The lateral 2 slips are inserted by combining each other, are inserted on the base of terminal phalanx, but the medial slip is inserted on base of middle phalanx. Okay, now let us see the types of ulnar lesions, ulnar nerve lesions. Now any lesions which is above the elbow is called as high ulnar nerve lesion, and the lesions which are below the elbow and which are not involving the muscles of forearm which are supplied by ulnar nerve is called low ulnar nerve lesion. Okay, to test ulnar nerve there are some tests. Now Egvar's test is for dorsal interossei. See dorsal there is a mnemonic which I have written here, DAB, DAB and PAD. DAB is for dorsal interossei. See dorsal interossei causes abduction, so DAB, dorsal interossei causes abduction, and PAD, palmar interossei causes adduction. In Egvar's test we check the abduction of middle finger. So you ask the patient to move his middle finger sideways while the hand of the patient is kept flat on a table and the palmar surface is down. Okay, in card test is for palmar interossei, and in this test examiner inserts a card between two extended fingers and the patient is asked to hold it as tightly as possible while the examiner tries to pull the card. The power of adductors can thus be judged. Okay, and to for adductor policies, the adductor policies causes adduction of the thumb. So the patient is asked to hold a book by his thumb, and when the examiner tries to pull it out of the hand of the patient, if there is paralysis of adductor policies, the patient will try to hold it by flexor policies. So by when the flexor policies longus is acting, there will be a marked flexion of distal interphalangeal joint of thumb. Okay, or I should say interphalangeal joint of thumb. Then this sign is called as from. And the sites of ulnar nerve lesion, it could be a thoracic outlet syndrome, it could be at brachial plexus injuries like in Klumpke's paralysis, it could be at cubital tunnel, I have told you cubital tunnel syndrome, and the Guen's canal is located above the retinaculum where ulnar nerve divides in two parts, superficial and deep branch. Okay, now see this is a typical ulnar kilo hand which you can see. In ulnar kilo hand there is paralysis of interossei. Now see, I have told you about